Okay, student, today we will discuss about one more disorder, that is epispadias. In a previous video, we discussed about hypospadias. So, what is epispadias? Epispadias is congenital abnormal urethral opening on the dorsal aspect of the penis. Dorsal aspect means upper part of the penis. So, in the last video, we saw hypospadias, that is a lower part of the penis. Okay, see in a picture you can see this is hypospadias, lower ventral aspect. This is a dorsal aspect. So you can see this is a hypospadiasis and this is a epispadiasis. So here in this picture, this is the normal urethral opening. This is hypospadias ventral and this is a dorsal epispadiasis, what we are discussing now. So what may be the causes for this? Causes is during the malformation during developmental stage. When the child is in a mother womb, during the developmental stage, it is not well developed. So classification, it is classified as a anterior epispadias and posterior epispadias based upon the urethra. Anterior means front part, posterior means usually back side. So based upon urethra where it is opened, if it is a front part of the penis means it is anterior, back side of the penis means it is a posterior. How to diagnose is, as I said, explained in hypospadiasis also, immediately after the birth itself, maybe the mother is in a labor room or a OT, wherever the pediatrician will be there, they will do the physical examination. Immediately after the birth itself, the doctor will come to know the child is born with this condition of a this condition, a particular problem. So immediately they will explain to the parents all that things. So apart from that, IVP, intravenous pyelogram, that is the X-ray of the kidney, urethra and a bladder they will do. Then MCU to detect upper urinary tract abnormality. MCU means micturition cystourethropy, to know the urinary flow, whether it is from the bladder, again goes back to the kidney only. Because here epispadiasis, if it is a posterior epispadiasis, means a back side, means a upper part of the penis, back side means it is directly connected with the bladder neck. So bladder neck the urethra will be connected. So there is more chance for the urine to flush back to a kidney only. To know that, they will do MCU also. So what all the problem faced by the child, as I explained in hypospadiasis, is same. While passing urine, child may the erection of the penis will not be there. The curvature means chordae will appear, so that it will be a very painful while passing urine. Child may cry out also. That is the one thing. Second things, child may not be able to stand and pass the urine. Child may be need to sit and pass the urine, or while passing the urine he may wet his thigh and all. So it required the management only. It required treatment, that is a surgical correction only. Surgical correction will be done at once only or in a stages, 3 different time in a stages it has to be done. The first 2 years of age, for penile lengthening, chordae correction. Chordae means the wrong curvature, the bending like curvature of the penis, it has to be corrected. Means the urethra, abnormal opening of the urethra will be closed. Second, after the 6 months of first surgery, that's a urethral correction. Third is a 3rd to 4 year, because within a 6 year the surgery has to get over. Okay, 3 to 4 year of age, bladder neck correction and a cystoplasty, repair of the bladder has to be done. See here you can see that whatever I explained, chordae correction. See, this is the bending. While child is passing urine, instead of the penis to stand straight or erect, it will bend. This bending curvature will lead to pain for child, very severe pain. So the child will wet his thigh and all. Okay, and if it is not corrected, means in a later stage the client will be having problem in his reproductive, okay, inability to have like a comfortable or a happy sexual life. So it has to be corrected. Okay, myotomy means abnormal urethral opening is closed, and at the center of the penis the urethral opening is created. So you can see it here. So what may be the Nursing management, as usual, always assessment include history collection, physical examination. After the physical examination, based on signs and symptoms, forming the nursing diagnosis, psychological support to the parents, health education to parents. After surgery, how to take care of the child, maintaining good personal hygiene, changing the dress after the defecation as well as the urination, properly cleaning the area, because child may not be able to look after self. So it is a major responsibility of the parents, and follow up at the right time with all the blood investigation and all the reports and seeking the doctor. So these are the health education the nurse must deliver to uh, the child's parents. Thank you, student. Hope you understood.